Alright, so now we're going to be looking at a nerve that is a little bit more elaborate. This nerve would be the trigeminal nerve. Okay, the trigeminal nerve emerges from the lateral aspect of the pons back here. It actually has a large sensory root and a small motor root as well. They're not actually indicated on this model, but know that the trigeminal nerve both has sensory and motor components. In general, it is actually called the great sensory nerve, but the motor components are very important as well because the trigeminal nerve innervates, for instance, all of the muscles of mastication. In addition to that, two other small muscles as well, and they're called the tensor tympani and the tensor veli palatini. The main sensory function of the trigeminal nerve is to provide general sensory information for the head, so that includes your face, teeth, mouth, nasal cavity, and the dura of your cranial cavity. Yeah, so if someone has like a dural headache, well, that's actually mediated largely by fibers from the trigeminal nerve. Okay, so the sensory root of the trigeminal nerve, let me highlight the trigeminal nerve itself, okay, is actually composed mainly of central processes of neurons in the trigeminal ganglion, which is directly next to it. And you might also hear other names for this ganglion. Some people call it the Gasserian ganglion. Some people call it the semilunar ganglion. Maybe they believe it looks like a half moon. Anyway, trigeminal ganglion is the most usual anatomical term for it. So the peripheral processes of the ganglionic neurons are going to divide into these three divisions. You have an ophthalmic division called V1, and the V actually stands for cranial nerve number 5, and that's the first division, so ophthalmic division. Then you have V2, the maxillary division, and V3, the mandibular division. These three divisions will pass through, for V1, the superior orbital fissure, for V2, through a round hole, so it's called the foramen rotundum, and for V3, well, that foramen is actually a little bit oval if we look at it, so it's called the foramen ovale. Yeah? This little hole, well, it's close to a spinous process underneath. That is the Foramen Spinosum, and that is important because the middle meningeal artery passes through there. The third division, or the mandibular division, is of special importance because, as I mentioned just a second ago, there are motor fibers that are traveling with the trigeminal nerve. Well, all of the motor fibers will actually travel with V3, the mandibular division. And these will be distributed to the muscles of mastication and muscles called mylohyoid and anterior belly of digastric, and of course the tensor tympani and tensor veli palatini. Don't worry about the small muscles first. The big picture is muscles of mastication. So if we focus on the sensory distribution, well, the ophthalmic division and the maxillary division and the mandibular division, they're going to innervate very specific regions of the face. Let's see if we can maybe find us a picture with the dermatomes. And voila, here we can see the distribution now of the ophthalmic, the maxillary, and the mandibular division of the trigeminal nerve. So you can see that V1 covers a large amount of the scalp, all the way up to, just the tip of the ear here, and that goes all the way over to the other side. And it also covers the region of the upper eyelid and all the way to the tip of the nose. Not the sides of the nose, though. V2, the maxillary division, runs as this sliver for the lower eyelid and the sides of the nose, including the nares or nostrils, but stops at the sides of the mouth or the lateral angles of the mouth. And V3, then, the mandibular division, actually the nerve is called the mental nerve, comes out of the mental foramen down here and distributes all the way around here. So V1, V2, and V3, that is the sensory component. Now we're probably going to have a look at some more details for the individual divisions. Alright, so V1, the ophthalmic division of the trigeminal nerve, we can see here, well, the ophthalmic division passes through superior orbital fissure. Okay, here is the trigeminal ganglion, that is the trigeminal nerve. Here's the ophthalmic division, and first and foremost, the ophthalmic division or ophthalmic nerve only does somatic sensory. Yeah, it passes through superior orbital fissure, as you can see here, supplies quite some important things, like, for instance, your cornea, your upper conjunctiva, mucosa of the anterior superior nasal cavity, so inside the nose here. The sinuses, well, at least the frontal and ethmoidal sinuses, part of the dura, and the skin of the back of the nose, which I showed you a little bit earlier on. Fairly similar, at least in regards to what it can do. The maxillary division of the trigeminal nerve also can only do somatic sensory. It does pass anteriorly through the foramen rotundum, which is called foramen rotundum because it's a round hole. The mandibular division will go through the foramen ovale, but about the maxillary division, it'll, after it passes through foramen rotundum, it'll supply the skin on the cheek and on the face here. In addition to that, it'll also do some of the conjunctiva of the inferior eyelid, some of the mucosa of the nasal cavity, mainly though the posterior aspect of it, also the maxillary sinus, which is, well, within the maxilla here. The teeth of the maxilla, this is why this nerve or this division has to be anesthetized if you have dental work done here, and the upper lip. The most substantial part of the trigeminal nerve or trigeminal ganglion is the mandibular division down here. It passes through a oval opening called the foramen ovale, and it emerges through a foramen ovale down here. See if I can zoom in a little bit more. Sure enough, here it is passing through the foramen ovale. You can already see that it will then give off a couple of branches, and then it'll pierce an opening within the mandible, which is called the mandibular foramen. And you can see here how the nerve splits off a little nerve here. This is the nerve to the mylohyoid, and the nerve exits right here through the mental foramen. Okay, now putting that together in the context with the sensory distribution, that all kind of makes sense, doesn't it? No pun intended. Upon emerging through the foramen ovale, this is something quite interesting. If I have a look at this, we can see that there's several branches that get split off, and they have different names. For instance, there's a branch that goes over to the side, it goes close to the ear and the temporal region, so that nerve is going to be called the auriculotemporal nerve. Here's the auriculotemporal nerve, and I would say it's probably the most famous or most significant branch of V3. Careful with that statement, only because here you can see that it seems to be a loop. Well, it is a loop because usually, I'm saying usually because that's just generally the case, usually this nerve, the auriculotemporal nerve, will form a loop around the middle meningeal artery, which will actually be a branch of the maxillary artery and go through the foramen spinosum, very close to the foramen ovale, and supply the meninges. Okay, the auriculotemporal nerve is a branch of V3. So is the masseteric nerve. If you're going to do this in lab though, please be aware this nerve has probably been destroyed because most people, they cut the head of the mandible, they cut the coronoid process, cut the zygomatic process out, and you know what? The masseteric nerve is going to be sacrificed in that process. There are also some more deep temporal nerves here. Here's a sensory nerve called the buccal nerve or buccal nerve. Yeah, it does sensory to the cheek. And if we have a look at the inside here, here's the lingual nerve, which is also a branch of V3 that will supply the anterior 2/3 of the tongue with general sensory innervation. However, don't want to jump the gun here, it will also convey some fibers that have been hitching a ride that will convey special sensory. Okay, the special sensory and actually also parasympathetics are hitching a ride via a different cranial nerve number 7. We will get there though. The components mediated or conveyed from the trigeminal nerve itself are purely sensory.